It's a medical problem that kills almost as many people as AIDS each year, yet it's rarely discussed. Side effects from taking over-the-counter painkillers are responsible for an estimated 16,500 deaths and 103,000 hospitalizations each year. Susan Burkholder began taking an over-the-counter anti-inflammatory to overcome pain in her foot.
I started taking Aleve. I took it as directed twice a day and had good results. However, after taking it for 3 months, I became ill, was hospitalized, and diagnosed with a stomach ulcer.
Studies have shown that serious complications, such as those Susan experienced, can appear rapidly and without warning. In fact, the use of over-the-counter pain relievers can increase the risk for stomach bleeding by as much as 2 to 3 times. And those incidents are the most common adverse drug reactions reported to the U.S. Food and Drug Administration each year.
Open your mouth now for me.
Dr. Christopher Barley, an internist at New York Presbyterian Hospital, has seen his share of patients like Susan and knows that over-the-counter pain relievers have serious risks that consumers often ignore or are unaware of.
The most common side effects range from just simple irritation of the stomach to ulceration of the stomach to perforation and bleeding of the stomach, which can lead to hospitalization and even death.
Linda Galodner, president of the National Consumers League, is spearheading an educational campaign to address this issue and recently released startling survey results.
The National Consumers League represents consumers all over the country, especially on using safe products. Our survey found that 84% of adults are taking over-the-counter pain medications. And a lot of people don't understand the risks.
In a survey of 4,200 Americans, almost half admitted taking larger doses of OTC pain relievers than recommended. 50% were unconcerned about serious side effects that can result from taking over-the-counter pain relievers, and less than 1 in 5 reported discussing the risks with a physician or pharmacist.
I consider myself lucky. Now, before taking any medication, especially over-the-counter medication, I realize there may be potential dangers.
Anytime a patient is going to be taking an over-the-counter pain medicine for longer than the time allotted on the bottle, or they feel they need to take larger doses, or they feel that their pain isn't being relieved appropriately, they need to contact their physician.
This is Richard Murrow reporting.